Welcome to the MOASC Researcher of the Month. Today, I'm delighted to really commemorate this month with Dr. Santosh Kesari, who's the Director of Neuro-Oncology at the Pacific Neuroscience Institute. Dr. Kesari just has such an incredible reputation in the field of neuro-oncology. He actually completed his medical school training at the University of Pennsylvania with an MD and PhD there both, and then he finished training subsequently in neurology at MGH. Did a neuro-oncology fellowship at the Dana-Farber, and since then has had hundreds of publications in the field of neuro-oncology, and has been just tremendously impactful. Dr. Kesari, welcome.
Thank you, Samantha, for inviting me to this and for this honor.
You got it. Well, I just wanted to start with a quick question to you. What research that you're doing right now are you most excited about?
Well, I have to say that probably the most exciting thing is still targeted therapy and obviously immunotherapy. And what we've learned from lung cancer, breast cancer, and in GU world, and trying to apply that in brain tumors is really quite challenging. And we're making progress there slowly now because it is the era of personalized medicine, and we just have to figure out how to incorporate biomarkers and the right targeted drugs and immunotherapies for our patients, because it's not just one disease, it's a complex set of diseases that we deal with, even though it comes under one name of glioblastoma or high-grade glioma. So that's a challenge that we have right now, and I think that is what the future of neuro-oncology is all about, is really understanding markers and picking the right drugs for each patient.
Makes perfect sense, and that dovetails into my next question, which is for our audience. What clinical trials are you most excited about right now that you're running there?
Yeah, so one of the things that, two things really, and one is sponsored studies that are based on biomarkers. Like for instance, we're very excited by this FGFR clinical trial. It's obviously available for all solid tumors, but we saw some initial responses with this one FGFR inhibitor, and now we're opening a glioblastoma specific clinical trial. So I think we need to do more of that for the EGFR pathway, PDGFR pathway, mTOR pathway. And those are the types of trials that we're very excited by. But in terms of immunotherapy, we have not made much progress. And in the last 10 years, there is some inklings of responses that we're seeing. And I think now what I'm doing is developing our own ideas and concepts of doing immunotherapy and personalized treatment and combining them early on in the disease cycle. So at the time of diagnosis, trying to incorporate and use those drugs in a very early fashion, even before radiation and chemotherapy. It's almost like a neoadjuvant type of setting. And I think that's where I see a lot of promise and hope. And some of the data that we've generated based on our own studies suggest that it is a viable approach, and that it may be the best in terms of leading to long-term outcomes. And so that's what I'm really excited by, is really incorporating these new approaches, but much earlier on in the disease course.
Fantastic. Well, thanks so much, Dr. Kesari, and congratulations again on being selected as the MOASC Researcher of the Month.
Thank you very much for the honor, and appreciate that. Thank you so much.